Hello everyone and good afternoon. Welcome to the Director Seminar of the Institute for Global Prosperity. For those of you who've not attended one of these seminars before, I am Henrietta Moore and I'm the founder and director of the Institute for Global Prosperity. And this afternoon, I'm delighted to welcome two colleagues from Warwick University. But first of all, let me introduce Professor Andrew Oswald. Professor Oswald is Professor of Economics and Behavioural Science at the University of Warwick. He's one of the UK's most distinguished economists. His research is primarily in applied economics, but he's currently working on the COVID-19 crisis and on health economics. But in more normal times, he's worked on mental health, on unemployment, on labour productivity, and on, very importantly, on human happiness, which is something that he has made a very distinguished contribution to in the UK. But the thing I like most about Professor Oswald's work is that as an economist, he asks that really important question, which so many economists fail to ask, and that is, what should citizens expect of their governments? So Andrew, I'm going to ask you to talk for a few minutes to introduce some of your ideas and work, and then we will open up to a discussion between me and you and others, and then we will take things forward in a debating kind of style. So could I ask you please to make a statement for us to get us going?
How nice of you to invite me to talk, and I won't speak for very long because I view Zoom kinds of seminars best as ones with lots of discussion. It's a good day for this in a sense because I'd like to talk about COVID-19 policy, and of course I hadn't anticipated that Mr. Johnson would lock down England starting more or less on this very day. This talk is also being given in the normal conditions of 2020. I have a dog that's just pushed its way into my office and is now lying next to my chair, and my wife has just finished making a kind of speech at another university meeting. Many of us know what this is like. A few years ago, a man called John Broome wrote a book I'd recommend to anyone called Weighing Goods. And John has the unusual distinction. He was a professor of economics, in his case at Bristol. Then he became a professor of philosophy, eventually at Oxford. So he crosses those two disciplines. And the book about weighing goods is really about how to make ethical and efficient decisions, weighing things up in the world. And I'll think about that throughout this hour or so, because in a sense, we have to think about weighing harms. That's one way to conceptualize it all. Things are difficult with COVID for all of us, and we have to make choices about what's the way to minimize, you might say, the different harms from a policy. I'll be joined, I'm very grateful to say, in this discussion with my youngish colleague Thijs Van Rens, who's a professor at Warwick, and I hope we'll get Thijs to speak and to present some data, but I just want to present some ideas for a few minutes. It seems to me that we can think about ethical questions, and I'd like everyone to turn over in their mind, is it morally justifiable to pass large amounts of debt onto our children and grandchildren and great-grandchildren to extend my life or improve safety for my age group? Probably everybody in this meeting knows that it's the old who are mainly threatened by COVID. And is it fair? Is it morally just to expect the generations to come to pay almost all of the bill? I'll also be interested in the ethical question, which is fairer, which is more just, to lock down regions or to lock down age groups? And to some degree today, I suppose I'm going to recommend we should be locking down age groups, even though I've reached the point where I can draw my state pension, if everybody knows what that means. It's also important logically, leaving aside ethics, to think about the likelihood of a vaccine. I really would like it if all the government briefings began by saying, we're going to suggest policy because X, Y, Z is what we think about the effectiveness and the speed at which a vaccine will arrive. Because I think you could argue that if the vaccine is going to take 18 months or more, or not be very effective, it's hard to justify any lockdown at all. So the notion that a vaccine will be effective and come quickly seems crucial to what our country is doing and many other countries. Let me give you some background facts, then, if I may return to the ethics, and then I'll stop and throw it open for discussion. The key fact is that age is overwhelmingly the risk factor for bad effects from COVID-19, just sheer chronological age. Just to put that into stark terms, if you look at the distribution, sadly, of deaths from the ONS data, the Office for National Statistics data, if we look at people under the age of 40, then about 300 very sadly have died under the age of 40. If we look over the age of 40, very sadly, about 55,000 people have died. This is, from a statistician or mathematician's point of view, astonishingly skewed as a kind of distribution. And that does mean that the harms fall on one particular part of the population. Currently, I would say it's reasonable to argue that COVID policy is not faced up to that. COVID policy in its design has not been fashioned around that key fact. Here's another thing to think about. The best current estimate, I would say, of the losses, the financial losses, comes to about 450 billion pounds, about 450 billion pounds. I heard a few hours ago that Mr. Sunak is going to extend the furlough scheme for another 4 or 5 months. So this will undoubtedly go closer to 600 billion, I would say. Now, we only have 30 million people working in this country, roughly. So that will be a bill of £20,000 per person. And one day that will have to be paid. And it will essentially be paid by my children, grandchildren, and their great-grandchildren. So I think we have to weigh harms. We have to decide whether it's legitimate, whether it's worth it on a cost-benefit analysis. I'm sorry if this sounds hard-hearted and too much like an economist, but if we take the criterion used by NICE, the National Institute for Clinical Excellence, it's impossible, given those numbers, given the NICE criteria, to provide a cost-benefit justification for lockdown policy, unless it were to save, let's say, 600 or 700,000 lives, and nobody, not even Imperial College, is suggesting that. As explicit examples of cost-benefit analysis, and then I'll largely stop, you could look at the, I think, important papers by David Miles, who's a professor at Imperial, by Sanjay Reddy, who's a professor in New York, and by work by Robert Rowthorne and colleagues at Cambridge. To my knowledge, all the cost-benefit studies that have been done don't favor the view that lockdowns are desirable. That's because the costs of lockdowns include, let me go through a list, of course, the financial losses that we're going to push onto the next generation, the huge mental health effects on our young people. They've been especially badly affected, we know from the data. Many cancelled cancer operations and so on. A great loss of social meetings and happiness. And perhaps this is my biggest concern and related to John Broom's book. I would say, even though I'm in my 60s, tremendous intergenerational unfairness, where my generation and older, I would argue, I know it's an ethical judgment, my generation is being unfairly helped, and too much debt is being pushed onto the young. Is it morally justifiable to do that? Well, I hope that we'll discuss all that shortly. So let me hand over to Henrietta again, but I hope to speak for a few more minutes later on. Thank you.
Thank you very much. Well, let's start with some of the most difficult things. So one of the questions is, what kind of a crisis is this for us, the COVID-19 crisis? So on the face of it, it ought to be a public health crisis. But a public health crisis, or the public health discourse rather, that's behind the whole discipline of public health, takes the view that all deaths matter. And it seems to me that the COVID-19 crisis isn't taking the view that all deaths matter, or rather the lockdown approach to the COVID crisis doesn't take the view that all deaths matter. it takes the view that the COVID deaths are more important than others. So this raises some of these very difficult ethical challenges immediately. And I think that the idea of behind that is that public health is really about maximizing population health, so maximizing population health for everybody. And this raises, of course, the issue that you've raised about why is it more important to take account of what's going to happen in the young, because of the way of calculating that means that you would need to do that if you're going to maximize population health. So why is it, do you think, that the government has decided to take the view that what we're really doing is not maximizing health, but minimizing death? Well, how does that work exactly?
Perhaps I'm the wrong person to ask, but I'm going to take a stab at it.
Yeah.
One might feel that if I was a conservative politician, I hope this isn't too harsh a way to put it, I'm more concerned about the votes of the old, partly because I might think that the young are not paying attention. They don't really understand what's happening. They haven't got a good grasp on the enormous debt that's going to be passed on to them. I'm afraid it will be super austerity.
Yeah.
Right. We've already reached the point where it's twice as expensive as it was to get out of the financial crisis. So we are talking super austerity, especially given Mr. Sunak's announcement today. I think that's the key thing. On a slightly fairer-minded note or brighter note, I do understand that the idea of the health service, as it were, being overwhelmed is horrible, isn't it?
It is.
No question at all.
Yeah.
But the deaths and the misery and the unemployment and the mental health to come over the next 25 years, especially among younger people, and that matters as well. But of course, it's hidden in the short run. Ultimately, Henrietta, I'm going to go back to, we're weighing harms here, and it's all pretty awful.
Yeah,
so we have to decide what's the appropriate balance of harms.
Indeed, but one of the questions is the time frame over which we do that, which is something you've alluded to, and this is one of the real difficulties for economics. So if we could try and set this in the in the context of how well economics can deal with issues about great uncertainty around long periods of time. So if we're going to calculate the costs of the lockdown for COVID, I mean, this is something that's going to be seen way, way down the line, some of these costs. And so actually putting them together now, never mind the cost of the furlough and the cost of printing the money and all of this and the debt and so on. So how easy is it as an economist to really able to model that? So I think a lot of listeners want to understand, is economics able to do that? I mean, how does it work from an economics point of view?
Yes, I think it is, of course, a very difficult calculation, but these three cost-benefit studies that I mentioned by Miles, Reddy and Rowthorne, they make a stab at a lot of that. They don't, they're not exactly the same. They don't weigh the same factors in exactly the same way. But yes, economics is in the business of making cost-benefit judgments, and certainly over time, there will be uncertainty attached to the estimates. But that's true for Boris Johnson and his assessors as well.
Yeah.
I don't hear from the government. I appreciate the difficulty. I really do. It's a tough time to be a minister, but I don't hear from the government. We've weighed these benefits with these costs, and this is what has come out. I sat through the Boris Johnson speech with Whitty and his colleague presenting graphs. I don't know whether you did. And we had about 18, I'm afraid, scare graphs of terrible things. Certainly that's important evidence. But the other side, the other bit of the cost benefit calculation wasn't presented at all. And everything inside me as an economist, as a behavioral scientist, as a kind of health researcher, thinks that's not sensible. No.
But it is quite a difficult calculation to do, isn't it? Because actions have to be proportionate across space and time.
Yes.
And these kinds of ethical judgments that we need to make. And so then it raises this question of how do we make proportionate judgments about differences across space, or we could think about differences across groups in the United Kingdom, and then, of course, in relation to other kinds of countries as well. So what I'm thinking about is that if we'd had an equity-sensitive approach to lockdown, then this would have recognized that some people were more at risk than others, yeah, and that would have been a possible way of looking at it, in the same way that we might have understood that a more equitable approach to lockdown would have said, why have we been, why has the WHO been encouraging Africa to lock down when Africa's got a much younger population, so it has a demographic bulge, no way of paying people who are in the informal labour market when they're all closed down, yeah, and very little evidence that the spread of COVID has been as aggressive there, for example. So it's interesting that, I mean, do you think it was basically a kind of global panic that took hold of people, the idea of lockdown?
That's a very deep and interesting question. There's no doubt that politicians are subject to herd behavior like most animals,
Yeah.
including human animals. And one sees the opprobrium that was heaped upon Sweden for month after month about standing against the herd.
Yeah.
So I think that once a few prominent countries went to lockdown, the pressure on Great Britain to go to lockdown was enormous.
Yeah.
And that's how herd behavior works. You, just like a sheep in a field, you want to get one inside the next animal because the extreme animal will be picked off by the predator.
Yeah.
If all countries wrongly go into lockdown together, their politicians are more or less immune from criticism because they're sheltering in the herd. Yeah. I don't mean that to sound so harsh as it might come over, but those are just the pressures on politicians.
Well, I was very struck that there seemed to be very few social scientists on the SAGE group who was making or giving the advice to government. And you would have expected, and I know this is an area, behavioural science is an area that you're very interested in, and I wondered if you had any thoughts about that. There seemed to be relatively a great reliance on epidemiology. And where Professor Ferguson and his team said right at the beginning in their first report, we do not know the consequences of lockdown, but we think it's a good idea, right? And that in a way that was never modelled, the behavioural side of things, what would happen there.
No, that's correct. There are very few behavioural scientists on SAGE and there are no economists. Now that is simply a stunning fact. If you are weighing up the huge financial costs against the pretty clear potential health benefits, you have no economists, you don't need much imagination to know which side will be overweighted, in my opinion. If we'd had only economists on SAGE, the economists would have been obsessed about the financial losses and not paid enough attention to health. And I suppose the enduring thing we learned from this whole crisis is that we needed from the start a mixture of disciplines. Even though the public health people get very angry with me. I've even had one friend, a public health expert at a dinner party, more or less shout at me and call me immoral because I signed a letter saying we should consider another approach. The public health people really feel and have been trained to feel that lives, approximately speaking, only lives matter.
Yes, but it was interesting there that we didn't learn from other experiences, and perhaps Northern Europe in particular and continental Europe hadn't had the experience it needed. So I'm thinking about how countries who'd already experienced Ebola and SARS were much better prepared for this kind of experience. I mean, was that your view as well?
Yes, that's right. And clearly when you look at China now, I was teaching a Chinese student today, and she's in China. Of course, she hasn't come to Warwick just at this moment. And she was saying it's almost completely safe. They hardly need any masks. And of course, our country, in a sense, has been devastated. Yeah, no, that's very true. So there was a certain arrogance there, but I think also there was a certain misunderstanding about the role that behavior change plays. So there's quite a lot of contention, isn't there, about whether or not just before we went into lockdown in the United Kingdom, and indeed for some other countries as well in Europe, but just before we went into lockdown, whether there was some kind of slowing in the infection rate already because of behavioral change and some other factors that were relevant. So, we could have brought the figures down, perhaps not so quickly, but by really emphasizing that you had to follow the behavioral changes. Yes, that's possible. I mean, we're into very difficult territory there, of course. And I certainly don't expect policymakers to have perfect foresight and so on. We had to learn as we went along.
Mm.
I'm delighted to take other questions now, if that would suit you, or I would like
I think so.
to allow.
Yeah, we can move on and do that. We've got them coming. Finally, Charlie started sending them down the line. So this is this is the moment we can move on. Yeah. So we've got one question from Modesta Janaskite asking, I wonder whether you're familiar with Stephanie Kelton's book, The Deficit Myth, and her presented modern monetary theory, where she argues that as long as the country has monetary sovereignty, the deficit is a normal part of the economy and it shouldn't be viewed as a debt. So would you like to comment on that?
I take the view that eventually deficits have to be made good. I do understand that real interest rates are very low at the moment. So one could make an argument that in a sense is not expensive to borrow. That's fair. I think that most economists would take my view that one has to repay the debts eventually, so that unfortunately these will fall very largely on people who are now very young, and to a considerable extent, I fear, on those not yet born. Mm. And as I've implied, it's a complicated decision, but is that ethically justifiable? Yeah,
I can see that. And we're going to take a question from Nikolai Minchev, and Nikolai's on the panel, so he can ask you face to face his question.
Hello, thank you, Henriette, and thank you, Professor Oswald. So the question that interests me is not so much about economics or public health, but rather about the sort of cultural and political dimension of this argument. And what I'd really like to learn a bit more about is why exactly this argument is considered so controversial and so contentious. And what is it about the idea of an age-specific lockdown that people find so objectionable? And perhaps also, who are the people who find it the most objectionable? Because when I was thinking about this, I was thinking that it's probably not young people objecting to it because they're going to be freed first from the lockdown. It's probably older people who think it's unfair that they should be held for a longer time. But I wonder whether you have a sort of answer to this question, and whether there is any kind of evidence to suggest why there's this controversy around this question, and perhaps whether there's sort of political costs that might come if this kind of policy is implemented.
Yes. I'd quite like, if I may, to draw on my colleague Thijs, with whom I've worked on age-related ideas in a second, if he would be able to say something. I'd be interested in his view. But just very briefly, yeah, it's been a remarkable thing for me. I've never had so much hate mail as when I went into print and on radio and television saying that we should use a kind of age segmentation approach. Indeed, there was a freedom of information request to the university demanding to know the age of Professor Oswald, because they assumed I was a very young economist, which is rather a nice thought. They thought I was a terrible young economist trying to upset the old people. Now, why does that cause so much emotional upset? I reckon Thijs might have a view, but I think it's because we've grown up recently with the notion that anything attached to age can be called age discrimination. And there's a deep, visceral response. I wonder if Thijs would you have a view on why is there so much opposition, do you think?
I don't know. The arguments that I have seen in the media seem to be more emotional than rational to some extent. I think there are good rational arguments to be careful about an age-based lockdown release. I wouldn't want to be seen as arguing that we definitely need to go down this path. However, it seems almost impossible to even discuss the costs and the benefits of an approach like that. And that does strike me as strange. For example, a quote I was about to show, Andrew will tell me when,
Mm.
from Simon Stevens, the chief executive of the NHS in England, whose reaction to the proposal to release young workers was that this would be age-based apartheid. Now, first of all, that's not an argument. But secondly, there's a very heavy emotional load included in that statement. So his view is clear, but it's less clear from that quote what his reasons for that view are. And that does, as Andrew was saying earlier, that does seem to be a bit of a schism in the way we think between the medical profession on the one hand and social scientists on the other. I don't think it's just economists. I think we are thinking of costs and benefits, and as a doctor, perhaps not necessarily.
Yeah, it's certainly true that there's been a lot of emotional, as you would expect, given the scale of the crisis and so on. So Thijs, before I ask you to come in with your slides and just talk us through some of the data, as Andrew promised. Andrew, there are just a couple of questions from people who are keen to sort of get an economic angle on this, which we could just take before we have Thijs, if you don't mind.
Of course.
So Flavia is asking that, given that this policy of lockdown was proposed in April 2020, that was 6 months ago, we've since had a second lockdown. So this is a sort of 6-month cycle. So what are the financial or economic consequences of having a sort of 6 months on, 6 months off? Would that still have the same very negative long-term effects that you were talking about?
Well, I think it wouldn't, of course, for as long as you relax the restrictions on businesses. It's when you stop people making a living that you get the sharpest economic losses. I think the mental health losses, especially on young people, are very serious, probably throughout. Although we can't get away from all of that because we all have anxiety at this time. It's just that we know the mental health hit on young people has been far more substantial. The more we can allow businesses to function in a fairly standard way, then the lower will be the economic consequences. And we have to make a decision as a society, as we're seeing. It's not an easy one, but to weigh things up. How much should we stop business operating? Yeah,
it's a very difficult issue. Well, we do have questions coming from Siska Dynam and from Michael Horowitz, but Thijs, could I ask you if you'd like to come in and just give us some data, because their questions relate, I think, to something that you might be going to tell us. So. You're still muted. You're muted.
Sorry, beginner's mistake. I was just having a look at the questions and I noticed there was at least one question which is asking about how would an age-based lockdown release work, and isn't there an issue with intergenerational households?
Yeah.
Exactly what I wanted to talk about.
Okay, good.
We'll do that. Let's give my computer a minute. There we go.
There we go.
So, as I said earlier, the argument against an age-based release seems to be at least partially emotional, but to the extent that there is a rational argument, it is well summarized by this quote recently in The Economist, which is the idea that people cannot change their lives in ways that eliminate their risk of infection, particularly when there is lots of infections all around. Those who care for them or live in the same home would get infected at some point and unwittingly pass the virus on. There's two things in this quote. One is about carers. So older and vulnerable people would be more likely to need care, and that care would be provided by younger people. And there is a risk of transmission there. To me, that's a different issue, because carers would tend to be professionals who, one might assume, are familiar with personal protective equipment, and also who would, in all likelihood, not live with their patient in the same house, in the same household. However, the point about people living with older and vulnerable people is very well taken, because there is ample evidence by now that the majority of transmission of this virus happens within households. So yes, there is a real risk if you start releasing young people that they're going to infect older people that live with them in the same household. Now, then the question is, are there many households like that? Are there many households where there is young workers and older and vulnerable people living together? So we looked at that in the data, and this is based on 500,000 people from the UK labour force, from 10 years of UK labour force survey. So here's my first chart, I suppose. I'm struggling a bit with Zoom that's blocking my view of my own slides, but this is a pie chart of people over 65 living in the UK. And the fraction of those who share a household with a young person. Of course, we need to talk about what old means and what young means. So here I think of old as over 65 and young of under 35. Now, if we were to release all workers younger than 35 years old, only 4.3% of the over 65s would be exposed to intra-household transmission because of this. And that is simply because the vast majority of over 65-year-olds do not live with a younger worker, do not share a household with somebody under 35. As I said, you might argue that 35 is not the right threshold. We're not quite sure what the right threshold for young is. So here I've looked at a few. 4.3% of over 65s live with somebody under 30, with a worker under 35. Only 1.7% live with a worker under 25. And if you were to release the entire workforce, everybody under 65, that's still only about 15% of the over 65s that would be exposed to intra-household transmission. You might argue that 65 is not the right threshold because we know that vulnerability to this particular disease goes up very starkly with age. So if you look at over 75s, you might not even have noticed that the graph changed because it looks very, very similar. 80%, 82% of over 75s live in households without any young workers in them. And then if you look at over 85s, the percentage goes down a tiny little bit. And that's because presumably at that age, some people do move in with their younger relatives. But nevertheless, the fraction of under 35s in these households is still very, very low, still only about 5.5% of the over 85s that would be exposed by releasing these young workers. Now at this point, I want to pause briefly and try to second guess what the emotional argument against such a release strategy might come from. And you might say, well, a pie chart like that is very sterile, and 5.5% or 3.9% may sound like a small fraction, but it's still a lot of people. And that is true, because there are an awful lot of over 65-year-olds in the UK. And in fact, 4.3%, which is the fraction of over 65s that would be exposed if we were to release workers under 35 years old, comes to 500,000 people. 500,000 people over 65 would be exposed. Over 75, that's still about 200,000 people that would be exposed if we were to release under 35-year-old workers, and over 85s, that's still about 90,000 people who would be exposed by a strategy like this. The reason these numbers go down sharply is not because the percentages change, they don't. It's because there are just many less 85-plus-year-olds than there are 65-plus-year-olds. So as a suggestion to hopefully reconcile a little bit the two opposing views here, I would suggest that we may want to, once we can have this discussion and once we can do a proper cost-benefit analysis, first of all, we might realize that yes, there's going to be costs, and those costs are going to be in terms of human lives, but nevertheless, that may be justifiable given the potentially huge benefits of releasing part or all of the labor force. But secondly, once we're having that discussion, we might be able to do even better. For example, we might only release workers who do not live with an older person. So here's my final graph. The pie chart has now changed. Now the full pie is not older people, it's young workers. It's the entire labor force, as a matter of fact. If you were if you were to release all workers except for the ones who share a household with somebody over 75 years old, you could release 98.5% of the, 98% of the labor force. If you wanted to protect everybody over 65, you could still release 92% of the entire labor force in the UK. Now, I believe this is quite possibly a feasible policy because it's not very difficult to prove your age, and we are very used to proving our address. For example, if you apply for a school for your children, you have to prove where you live. So it seems quite feasible to condition release on household age composition. And the big advantage, of course, is that you can now offer generous income support for these few workers that cannot be released, because you no longer have to provide support for the entire labor force. So simply because there's many less people that need to be compensated for not being able to work, it allows you to be much more general. That's what I had to say, really. Just to briefly mention that there's of course these are data for the UK. There is of course no guarantee that this will look similar in other countries, and there is reasons to believe that in some other countries, Mediterranean countries, for example, there might be less segregation by age in households. So this is not to be taken as a very generic policy recommendation. We did look at one other country, which is the United States of America, and there we find very similar patterns.
Thank you, Thijs. I mean, we have a question here to both of you, I think, but it was originally for Andrew, because Andrew was talking at the time, but from Siska Dynam, and she's saying, why not argue for the release of the 30 to 40-year-olds, because those are the people really who have more dependence and more financial pressure on mortgages and so on and so forth, so more need to actually be out. So what would your figures look like, Thijs, if you released all of, everybody up to the age of about 45, so everyone presumably rather similar from the point you're making?
Yes, so that was actually on the graphs. I can show you again if you like.
Yeah.
But
yes, please, yeah.
Roughly, the exposure of older people doesn't change very much with who you release, although of course, the more people you release, the more exposure there is going to be.
Yeah.
These are the 65-year-olds.
Yeah.
1.7% of them live in a household with a very young worker, somebody under 25. 2.6 plus 1.7, so about 4.3% live in a household with somebody under 35. If the suggestion is to release workers between 35 and 45 years old, that is about 3.4% of the 65 plus year olds that you would expose that way.
Yeah, yeah.
Could I chip in a little?
Yes,
on that
please.
Question? So it's a good question to ask. Why should it be the young particularly? And personally, I'd have no problem, I think, with allowing a cutoff going up to 40 or 45 even. But it's very important to understand that the very youngest group, say in their 20s, are the ones, according to the mental health evidence, who've been most harshly affected by the lockdown and the pandemic. And that's almost certainly because they don't have the established social networks. They have the largest rise in unemployment and so on. So you might say it goes back to the desire to keep down harms. The harms appear to be very large on the young. Yes,
and also your work shows that there's a very steep gradient going up. So once you're 50, I mean, your risk goes up massively. So if you go, presumably there's a crossover point somewhere on this graph.
The risk is a astoundingly accelerating function. As I implied from the deaths data, 300 people very sadly died under the age of 40, 55,000 over the age of 40. It's really a remarkable fact. I'm afraid this is the way this horrible virus works. As we age, our immune response system weakens. Yeah,
and also we've got a question from Konrad Micicevic also, and he's asking about, so multi-generational households, of course, do have a very specific kind of demographic and sociological representation in the UK. So that means that you would be effectively keeping people from BAME households at home, and also people from other kinds of perhaps of religious households at home too. And this might mean, of course, given the way that the labour force of the National Health Service works, that you might have large numbers of NHS workers at home. So I mean, these things are quite complex, aren't they?
I think that's an, sorry, Andrew, I think that's an excellent point, and I would suspect that the suggestion is true. We can look at that in our data. We haven't done that yet, but I should be able to find out quite easily how many of these intergenerational households are BAME. And I could even find out how many of them include a healthcare worker. So yes, these are all very relevant points. I think our main message, or at least my main message, is that we should be having this discussion, because there's huge potential to do better than this blanket policy that we are doing now. And yes, it won't be perfect, but what we're doing now is so far from perfect that it will be very easy to find something that works better.
Yeah.
And sorry, also to reiterate on the BAME household, I think regardless of ethnic origin, it is only fair that if we're going to release some workers and not others of similar age, then we should compensate generously the workers that we are asking to sacrifice for the public good. But it will be so much easier to do that generously if the majority of the workforce can proceed and do their regular jobs. Yeah.
So we've got a couple of questions here, and so one of them I just want to see whether you have any data or thoughts on it. So it's a question from Michael Horowitz, who started by saying, of course, that the issue for the United Kingdom was the inability to do contact tracing. But he says, why did the UK not invest in the most cost-effective intervention, which would have been the contact tracing? So Korea, Hong Kong, and Singapore. So if we'd done that, do you know whether it would have looked significantly different across this age profile that we have discussed? Because we have had now in the universities a different kind of argument where the young have been blamed for the spread.
That's touching on all sorts of important issues. One or two of the cost-benefit papers, particularly the Rowthorne one, I remember, actually looks at the intervention in their predictive framework of having better contact, test and trace. And that paper still ends up saying that generalized lockdowns are not efficient. I suppose we could all vote for better contact tracing and so on. I don't see that that's a solution. And we have to keep the economy going, in my opinion. I'm sorry if that makes me sound too much like an old-fashioned economist, but we have to pay the bills somehow for all the incredible resources that we're using up. And someone sent me a private note, by the way, over the last few minutes, asking me whether I had read this book by Kelton. I think her name's Stephanie Kelton, and I haven't, called The Deficit Myth. I'm sorry if I should have. It came out a few months ago. It has been very heavily criticized as non-scientific by heavyweight economists, but that's about all I know, having not read it myself. Right.
Thijs, did you want to come back on that, about whether contact tracing would have made a difference to this very steep age-related data?
I don't think it would impact much on the graphs I have shown, but I think it's relatively uncontroversial that it's a very good investment to invest in test and track and trace. And to the extent that that system isn't working as well as it should, clearly it's having enormous costs. So I don't think there is much controversy there. Insofar we should of course expand on the test and trace, with the caveat that test and trace can only work if you have a relatively low prevalence. So I'm actually not against lockdowns in every and all situations. I think they may very well be necessary periodically for limited amounts of time in order to bring us to a situation where we can resort to something else like test and trace.
Yes, and that that connects to a question that we've just kind of come from Juan Moreno, and Juan's asking, without discounting or ignoring rational arguments and epidemiological reality and so on, we would have to take into account that situations of income and identity and privilege and prejudice would and emotional responses of various kinds. So we talked about mental health might really shape how different age groups feel and experience this age release strategy. So this again would be quite an experimental. Do we have any data on that, whether how that works? Apart from the fact that people over 65 now think it's the new 40 and they don't want to be locked down. But apart from that problem, do we have any hard data on it?
Of course, we don't have data literally on what would happen if you had a sort of age segmentation lockdown. But I assume it would be fair to say that we can make a stab at guessing it, because we were all locked down, weren't we? Essentially, from late March. And we do know for sure, many studies have shown this, as I've said, that the mental health hit on the old was rather minor, despite what the pensioners might think. And they didn't enjoy it either. But of course, they didn't have to go to work. They didn't have to worry about unemployment. And most of them, of course, have established social networks. Many are living with a partner, and the very young people are not. So I would guess that even if we had a giant experiment or we tried the policy, we'd find the same pattern again. Yes.
Yeah. Well, I think perhaps we could talk a little bit more about the mental health consequences, because these are very, very grave, and the figures are quite astounding, actually, on the mental health impact. And that is one of those problems about we don't know what the consequence of that could be over long periods of time. So people just entering the labour force now and encountering that difficulty, and then over the course of their lifetime is a difficult thing to understand, isn't it?
Yes, we just aren't sure of the long run effects. At an anecdotal level, I know it's just anecdotal. My grandchildren know that they're not allowed to give me a hug. We see very young children in the media, very young children wearing masks and so on. My instinct, insofar as I'm qualified to make one, would be that these things might have very damaging long run effects on humans. So I'm concerned about that. I don't know of formal evidence.
We've got another question coming in about different kinds of ways of understanding the data. So should we try to evaluate the non-economic benefits of lifting the lockdown restrictions in monetary terms, so that we can have some kind of sort of comparable data on them? So I think what's being talked about here is there are quite a number of cultural and social benefits for lifting lockdowns, including being able to go to the theatre and so on.
Yes. Some of the cost benefit analyses do make an attempt to put a weight on that. For example, at least one of them tries to put a kind of weight on the happiness from socializing. I think nobody's got something exact like the ability to go to the theatre or the cinema. But in principle, cost benefit analysis could attempt to do that. And of course, as my colleague Thijs said, our broad message, I suppose, is that we need to be doing some kind of clear cost-benefit calculation.
Yeah.
Beyond that, there are grounds for reasonable differences about which weight should be put there, what coefficient, and so on. But something like this, surely, in a rational society, has to be going on.
Yes, a segmented approach, in other words, and of course,
that would be what might come out of it. But to my knowledge, I haven't seen every government briefing. There have been many, but I have sat through a lot. I've never seen anyone presenting the pluses and the minuses.
No, I mean, the government briefings are just about, whether we're doing a binary, really. So there's very little discussion of what the other alternatives are.
Yes, earlier this week, Chris Whitty was interviewed, and he was asked about economic losses, and he said, well, you need to ask an economist. And there, I completely agree with the man.
Thijs, you wanted to come in at this point.
I wanted to point out that, of course, we have been doing a segmented approach already, except we've been doing it based on geography. And to get back to an earlier question on what are the implications of an age-based release for things like income inequality or inequality by social economic status, I think that's a very valid point. And we do need to talk about that. And almost surely there are implications. If you release young workers, almost surely it's not going to be completely fair in terms of social economic status. And we may want to fine tune that. But of course, a geographic release is very far from equitable along this dimension either. And clearly the average social economic status in Liverpool is not the same as in London or in Brighton or whatever.
Yeah. So we have a question from Matt Davies, and because he's on the panel, he can ask it himself. Matt, are you there?
I am, yes. Thank you, Thijs and Andrew, for a wonderful presentation and a great discussion. I've been sat here trying as hard as I can to pick holes in your theory, not because I want to invalidate it, but just because I feel I should. And I'm struggling. But I wondered if there's a little bit of the maths that we might go over, because I'd be interesting to explore it. So we were talking about there being something like 400 or so deaths amongst under 40s so far, but that's on an infection rate based on periods of lockdown. So it's not just allowing the virus to spread completely freely. So if we were to release all under 40s, we would be creating a situation where the virus is spreading very, very rapidly, potentially, and so it has much, much higher numbers of infection rates. So how would that death rate and perhaps significant hospital infection situation play out in a situation where we let the virus go very rapidly amongst the under 40s?
Yes, that's a really astute point, if I may say so. We're pretty sure that about 7% or so of the population have been exposed to the virus, and that's fairly even across age groups. So if you want the projected deaths, a horrible concept, among those under 40, I have calculated that. It's on my website somewhere. Maybe Thijs also has calculated it. You would multiply by 14. So you'd multiply, it's 300, I think, times 40, but times 14, what's that? Is that 4,200? Anyway, we can do the calculation. And, you know, it's terrible to have any deaths, but we are weighing harms here. And not many epidemiologists or epidemiological models suggest that everybody would get a virus, even if there was, in a sense, unlimited coverage. So it would be fewer than that.
Interesting. And going on, sort of on a related point, going back to Michael Borowitz, who's asking, you know, perhaps there could be differentiated approaches to test and trace that would map on to some of the things that you're talking about, because test and trace has also been dealt with as though it's just one thing that we're going to do. And he's asking, why did Korea not need to go into lockdowns? Was it, did you need to stop the epidemic before it reached a critical mass, or what does health economics tell us about that situation, rather than Sweden, which we've mentioned already?
I don't know whether Thijs would like to answer that, or shall I go first, Thijs? I think that some of the Far Eastern countries were much more experienced at dealing with terrible viruses, you might say, flaring up, and therefore they were quicker to act, knew what they were doing, and in some cases, not necessarily Korea, but in some cases, of course, they ran societies in a way that wouldn't be allowed in the West. So they could act more harshly than would ever be tolerated by the Daily Mail and the Sunday Times and the Guardian and so on. And that's that gave them a kind of advantage, even though it carries with it an implicit disadvantage that the Guardian editor would point out, no doubt, if he or she were here.
Thijs, did you want to come in there?
I agree with that, but I also agree with the idea that, or I think it is also true that track and trace is a strategy that doesn't work if you have a very high prevalence of a disease in the population. So yes, that's what I said earlier. I do think there is a role for things like social distancing, which keep the R low-ish without really interfering with daily life and the economy. There is also a role for test and trace, and it's clearly a cost-effective role. So test and trace as much as you possibly can, but even a gigantic test and trace program will not be able to contain this disease if from a starting point of high prevalence. So there is also a role, in my opinion, for things like lockdowns, which should be temporary, and should then bring us to a situation where we can resort to other things like test and trace.
Right, right. That's very helpful. And so Hannah Collins is saying it's great to hear a debate about the alternatives to lockdown and social distancing and the impact on future generations. But she's worried that age segmentation release could enhance polarization and divide society even more, because there's a tendency to blame the young for a great many things, including currently the virus. Did either of you want to respond to that?
It's a really fine point. I don't know what to say to it. It's such a good point. I suppose that we're doing a kind of logic as we see it. But undoubtedly, the old would be extremely cross. I know that from all the hate emails and letters that got sent to me. Whenever you talk about this notion, I know colleagues who've even one had a death threat and so on from a madman. All this would stir up very strong emotions. Yeah.
And then sort of following on, going back to the connection between the young and the relationship to working in the labour force. So George Melios is asking, what could you say about the possible short and long run labour market implications of a policy that would have these time differentials in leaving the lockdown state? Do we understand that? And both inter but also intra age cohorts. So could such a policy be a driver for various labour market transformations in terms of sort of creative destruction and also getting rid of all the 50 plus?
I will leave
the labour market.
My distinguished semi-labour economist colleague.
So I think we don't have direct evidence on this because a situation like today hasn't happened before. However, there is every reason to believe there's going to be very long-term effects of people being excluded from the labor market, and those effects are going to be larger the earlier and the longer you are excluded from the labor market. I'm referring to a large literature on, for example, graduating in a recession. If you are unlucky enough to graduate during a recession, 20, 30 years later, you'll have a lower wage than an otherwise comparable worker who was lucky enough to graduate a year earlier or a quarter earlier when there was a boom. So I think there is every reason to believe there's going to be very long-term effects. But I think, if anything, this would strengthen the argument for a release prioritizing young workers, because they are where reintegrating them in the labor markets, the benefits are largest. And that's true both because they've got a longer working life ahead of them, but it's also true because that's when the scarring effects of not working are the most severe.
Yes, and we had all that, of course, because we got very good data from the 1980s on the scarring effects for the young and unemployment, and they are fairly horrific. So people are coming with different ways. They're very motivated by everything you're saying, so they're coming with different thoughts. But anyway, Bridget Story is asking now, how can we weigh the costs of this apparent long COVID that appears to affect the young, even if they don't have COVID badly, so that they seem to have a different kind of COVID? So do we understand really what the disease, I suppose the disease itself is variable, so this is another factor, isn't it?
Unfortunately, that is another cost, yes. And the best estimate at the moment is probably about 1% of those who are infected go on to long COVID, and that's very roughly the same as the death rate. So in a sense, the harms are possibly not exactly doubled, because long COVID is not as bad as dying, let's say, in terms of societal cost. But I'm not sure what weight we would put on it, perhaps half and so on. That would all have to be borne in mind in a cost-benefit calculation. And health economists for decades have used something called QALYs, quality adjusted life years, bearing in mind what you might say the quality of a person's life as well as sheer longevity. So that's a very important factor that would be in a proper calculation.
Yeah, it's a complex question how to do this calculation. It's not at all easy. So we've got a question, I think, from Andres Vicente, and he's also on the panel, so he can show himself. Andres, are you there?
Yes, hello. Thanks, Henrietta, and thank you both for joining us, especially because it's such an emotional topic. And like anything that questions the status quo, it gets attacked frontally. So it's good to have diversity of opinions. So I just wanted to pick up on Professor Oswald's like very early point. So just to say first that I am a life scientist. I've worked with viruses, so I come from a very particular background. And I want to say that there are many epidemiologists who question the usefulness of lockdowns as a strategy. But every time they raise their voices, they get attacked, and all that goes away. So I just wanted to pick up on the point of lockdowns. So what's the point of lockdowns eventually? Because they are not a battle-winning strategy. They are time-buying strategies. However, if you listen to like the media and policymakers and so on, the constant conversation is lockdowns and curfews, and that's it. Every now and then you've got a flare about the furlough scheme, funding for that scheme, and so on, but then that goes away and we go back to speaking again about lockdowns, again about curfews, and so on. And there's no discussion about actual solutions for actual problems. So we have more and more data as to how the virus spread. We know 80% happens at home. We know most infected people actually don't spread the virus to anybody at all. So when we talk about the R rate being 2 or 3 or whatever it is, it's a fallacy of the data. The R rate is mostly not for most people, but it's 10 or whatever it is for a small percentage of people who are the ones who then, through super spreader events, then it goes to a lot of people from these small events. So why are we not talking about things like ventilation being like a major factor now, and we don't talk about how we are adapting businesses, how we are adapting infrastructure in such a way that we are cutting infection at the root, rather than talking about, kicking the can down the road with lockdowns and curfews and things that are not actually going to solve the problem. Because test and tracing, same thing. It's like, it's helpful, and it will be helpful to trace these super spreader events, but it won't fix the problem until we fix the root of the infections.
I must say, you put it very well, if I may say so. And of course, you're quite right that any epidemiologists who speak up are showered with really personal abuse. It's become extraordinary, and I don't understand exactly why. The rationale for lockdowns must be that it is, as I think you put it, a time-buying device, because we're soon going to get a vaccine. At least that's my view. I don't know whether Thijs would put it slightly differently. And that means that for lockdowns to be rational, there must be a presumption from the start, almost never mentioned in government briefings, that a vaccine is close.
Right. I very much agree with the first part of what Andrew said, with the comment that I think that phrasing it as kicking the can down the road, I think, is the wrong connotation. I think there is a genuine value of lockdowns, which is that they buy us time. However, I would agree with you, or what I think your opinion is, that argument held a lot more water the first time around than now. And it's going to hold even less water next time. So it's about time we got ourselves sorted out and we came up with whatever we were going to use the time for.
Yes.
I disagree slightly, I think, with Andrew's point that the only reason for wanting to gain time is because then a vaccine may or may not be developed. I'm not an expert on this, but I'm a bit pessimistic on the vaccine that will be developed in the near future. I expect there will be one, but I also expect it won't be very good, which means that it's not going to be the game changer that everybody pretends it is going to be. But I think there are other things we are definitely learning. So the death rate conditional on contracting COVID has gone down dramatically. That is because we bought ourselves some time with the first lockdown. And the test and trace system, as imperfect as it is currently, it clearly is better than it was in March. So we have done some things. I will be the first to say that we could have probably done more and or better, but I do think there is a value of saving time. It's not just kicking the can down the road.
Mm-hmm. So we definitely have learned things in terms of treating people. And in fact, some of these treatments, I mean, we actually knew if we'd actually thought about it. So, I mean, you know, the death rate from intubation, which was what was being talked about at the beginning, is already well over 35% in normal circumstances. So we knew that once we were intubating large numbers of people, they would not be surviving or would not be surviving well. It's also a very traumatic procedure. So some of these new pieces of technology that came, you know, were speeded up. There was a speeding up of technological development, which definitely helped the treatment. And of course, understanding it better helped it as well, because in the early days, you know, medical staff themselves were reporting that they just didn't know what to do. Right? They were in great distress as to how to manage it. But I think it would also be interesting to explore some sort of social science ideas, because we're talking about going into the second lockdown, which we are doing now, this very moment as we speak. And so your presentations from both of you are very apposite at this moment. But in a way, we're not going into the same sort of lockdown as we went into the first time. We're going into lockdown in what we would call, in sort of anthropological terms, a post-lockdown world. That is a world that's already experienced lockdown. And of course, that makes a huge difference to what happens. So, you know, I mean, it's not
the first thing that a social psychologist would say, or a behavioral scientist, and some economists, is that when you take something away from a person, it's much more painful than the pleasure of getting it. That's sometimes called loss aversion. And I worried from the start, and I may have even put this in the early papers, at the beginning of the whole thing, that doing this the second time, we are taking away people's freedoms as they'll see it. They'll see it in a very sharp way. And I do think that the psychological losses will be much greater, or just to put it in regular terms, we're going to see a lot more rebellion. That would be my hunch.
Yeah.
Because it's the second time around, and that is how humans work.
Yes, and the other thing that's interesting about humans, and we do have questions both from Nikolai waiting for you and Matt, who they both want a second question, which I guess we have to allow them. But is that the regional basis, it never felt as though it was equitable, and that was a big problem. So that was one of the issues, and of course Andy Burnham said as much. So he just stood up and said, you know, this is not, we're not being treated the way everyone else is being treated. And so as soon as you come out of the framework of the important fantasy of the nation, and you have bits of the nation who are being closed down and other bits of the nation are not being closed down, that becomes a very unmanageable situation quite quickly from a political point of view.
I do have views on that, and I wonder if my colleague would like to say anything on that first, though. You can see the appeal of national lockdowns at the simplest level. It is treating people the same way, and I'm very conscious that a lot of the visceral response to the idea of age segmentation is you can't separate people. Even from the very first, it made me extremely cross watching him on the television. Jeremy Farrar, if you remember who he is, he's head of Welcome, and on stage, right at the beginning, just after a Warwick colleague and I had written a paper, and the Sunday Times had written an editorial saying it was a good idea, he said, oh, we can't treat different age groups differently. And I thought, you're a scientist, you are not there to make these moral judgments. And anyway, it's not clear why your moral judgment should be listened to. But humans, whenever you have any differentiation, human beings get very upset about it. Whether we should listen to that and do things that otherwise seem very, very foolish for society, I don't know. Well,
it's a difficult question. I think we can come back to that, talking about some of the ways that we did do things, for example, with the HIV pandemic, where we learned a lot about sectioning of different parts of the population. So now I think we need to go back first of all to Nikolai, who had a follow-up question, which he's probably forgotten by now. But Nikolai, would you like to ask your follow-up question?
Yes, I did forget, but I'll follow up to what was said just now about the visceral response.
Yeah.
You know, I'm wondering whether this response has to do with people's sense of morality and fairness, because, you know, Henrietta, as you mentioned, now there's a conversation that the people who are spreading the virus are young people on campuses. right? So if I was an older person, I would probably be saying to myself, why are younger people spreading the virus, like I read in the newspapers? And at the same time, they're the ones who don't get to suffer the lockdown, and I'm the one who gets to stay locked in. So there is a certain kind of moral logic to it, I think.
One could make age segmentation voluntary and simply give people a great deal of information and ideas, advice. I don't know whether anyone in this meeting noticed, but Boris actually in his speech a couple of days ago said anyone over 60 should be very careful. And that's the first time that anything below the very old age group has been mentioned. I think we're all agreed that there'll be strong emotional reactions to any kind of policy and somebody will be extremely unhappy. But I'd ask the question, why is it the responsibility of the young to stay away from the young? Why isn't it the responsibility of the old, like me, to stay away from the virus?
Good question. Matt, are you going to follow up on that in your question?
I sort of, you started some of the things I was going to ask about, but I was interested in revisiting this regional lockdown and regional controls versus age controls, because it is incredibly interesting that it has been politically palatable to large sections of the country to distinguish on geography. But it seems to be completely unpalatable to distinguish on age, which I think is a really bizarre, interesting thing. And particularly when you look at the geography that appears to be acceptable, it's very much the north of England, it's Wales, it's happy to let Scotland get on with their stricter measures if they would like to, it's Northern Ireland. It's not about geographical restriction of the south and the southeast, etc. And so I think this is a really interesting phenomenon, but I was just wondering whether you had done comparisons of the cost benefit analysis of the age lockdown versus the regional kind of approach, and what you could say sort of quantitatively about those, irrespective of, I think, the questions about the ethics and the morality perhaps of some of that.
I haven't done that calculation. You make a very, very sensible point, and in principle that should be done. My hunch is that partly people went along, at least for a little while, with regional lockdowns because I'm afraid in some sense, a lot of our population thought that, well, the groups that had the rising virus in a sense had behaved badly. And therefore there was a kind of justification for closing them down. I wouldn't be surprised if that weren't part of it. Now, of course, Mr. Burnham and others strongly objected, and there will always be objections to any kind of policy. Thijs.
Yes, Thijs, you want to come in now?
Yeah, so I second that. But I wanted to make a different point, which is that whereas when we talk about age-based release, everybody immediately questions whether that is feasible. And we try to show some figures to indicate that at least possibly it is feasible to release some parts of the age distribution without infecting others. Same argument is made much less often when it comes to geographic segmentation. And of course, the problem with a place like Manchester is that people leave from there and go to there. So just like there is transmission across age groups, there is transmission across geographic areas as well. And I suppose you were right, and we should do the maths. We should do a cost-benefit analysis for both a geographic and an age-based segmentation. But ex ante, it seems impossible that the optimal strategy would not at all condition on age and would condition on geography.
Yeah. So we got a question from Chris Harker, who's also, I think, on the panel. Are you there, Chris, in person? I can't.
Yes.
Good, perfect. Here you go. Welcome.
Thanks. I maybe have to apologize. It's a very broad question. So we've been talking a lot about essentially how do you solve or address a certain kind of problem. But I'd like to hear some reflection on your experience of the process of solving that problem. So to be a bit less obtuse. You've made this argument in the public press, and you've given some indication that you've had a very vitriolic response, which sounds horrible. Nevertheless, there may be substantive disagreements that could be expressed, in agonistic rather than antagonistic methods. So the question is, how do you understand the kind of political process that surrounds these questions as economists, and what kind of political process exactly are you arguing for?
That seems rather a subtle question. You may have to follow up with more detail on it. I look at the world and I think that the Conservatives, in particular Mr. Johnson, they are, I think, very concerned with short-term pressures on them as political figures, and they're trying to quite rationally minimize the criticism. They know that there's a large constituency of old people who, roughly speaking, support them and want a great deal of attention given to potential deaths and illness among older people. Perhaps not everyone formulates it clearly in their mind, but it's not the young who, as was said, that complained about these kinds of ideas. I don't think of the policy decisions as being carefully crafted, weighing costs and benefits. I do see the very difficult stance for a politician like Sunak, who wants to stand against these people who will give him endless predicted death figures and talk about the NHS being overwhelmed. I see the difficulty. The people who will be hurt in the future are not there at the table. They're not in the graphs.
Mm-hmm. Yeah, it's a very difficult process, because giving any kind of evidence, research evidence of any sort in a highly political situation is going to be contentious, but it's also going to be a question of how you, as the person giving the evidence, feel that evidence should be applied or could be applied. I mean, that's the issue, isn't it? I mean, the fact that people try to shut you up by saying horrible things to you is just a feature of life. I mean, so if we lay that to one side, but the actual question of what kind of relationship there should be between evidence and policy is a very difficult one, and particularly for economists, isn't it?
I agree with that. And there's something about this debate, this phenomenon, we must all have observed it. It has been exceptionally emotionally charged. Of all the policy design issues in my lifetime, I've not seen responses like this. I've had very little hate mail in my life, and you only have to read the different newspapers, see the astoundingly rude things that people say. One sort of scientist says about another. Could I go back to Christopher, because I imagine he's the sort of person who's thought hard about the political process here. Would you have a take yourself, may I ask, on how you see what's gone on?
I don't know if I can respond directly. I mean, in a sense, probably yes, but I think what I'm thinking about, and I genuinely don't have an answer for, is I sit here and I disagree with a lot of what you say, because I have a different set of assumptions about the world and a different understanding about the world and how it works. And I'll just take one kind of example, which is, I come from a human geography background where I've read a lot of sociology and anthropology that's argued for intersectional analyses. My own research has really argued for understandings of subjectivity beyond the kind of liberal individual. And it's the individual that is the statistical subject. So if one is using statistical methods and more broadly a cost-benefit analysis, one is always stuck with the individual. Whereas, as you mentioned to us earlier, you can't hug your grandchildren. We're not, arguably we're social beings, not individual beings. Now, this is a kind of difference of perspective. The question that I'm trying to think through is how do those different perspectives work in a policy context that particularly from the kind of aspects of or the parts of the social sciences that I come from seem weighted towards economic and cost benefit analysis that close down questions about other kinds of values, other ways of assessment that can kind of feed into those questions. I mean, I guess I'm going to sort of practically answer your question, which is, you know, I would move towards the kind of co-production processes that I think you've kind of gestured at a bit. But I guess there's a sort of skepticism with ever providing the answer, or, you know, without a very kind of cross-disciplinary and quite complex set of answers. And it may be difficult to provide the answers, which is, you know, a classic kind of academic meets policy.
I certainly agree that we need a cross-disciplinary, multidisciplinary way of thinking. And I would just like to say, we don't need to think that pound notes are what matter here. In a cost-benefit analysis, you can dispense entirely with money if you want. What I'm concerned about is, why should we push all the deaths and the lack of primary school and lack of cancer operations onto people 35 years hence? It's not about money per se.
And yeah, I mean, I'm certainly, there's no critique of the need to discuss and debate. And I think that's, yeah, what you've kind of offered us today.
Yeah, yeah. So we're still going for a second. So there's someone who is anonymous saying, what are your thoughts on the imported cases? So some other countries like New Zealand were much stricter when it came to controlling its borders, while the UK has never taken this approach. And even with this lockdown, the borders are still open. So how fair is that on the local people? So this is, again, a segmentation question, I suppose, or a movement question. Even.
I'm probably not uniquely qualified to make moral judgments about that, but I'll make I don't mind my judgments. I do think that it was easier for New Zealand. I know there's been quite intense debate about this, but I think it was easier for them to cut their borders off. We would have had to do so exceptionally early, and we are an international hub, whether you like it or not. But in principle, we are an island and could have taken an extreme suppression strategy. We could have done so. The economic damage and the social damage would have been remarkable. We'd have had to more or less shut everything and all borders for 3 months. I wouldn't have favored that, but it would be one approach.
But I also think that that might have been shutting the stable door after the horse was out, because we now know from the evidence from the hospital data for both England and France that we had COVID cases in November. And we didn't start registering any of them until February. So it was already in the country. So
yeah, I don't blame the politicians for not having perfect understanding and foresight, but it's clearly a difficult problem. I think my colleague would like to come in.
Yeah, Thijs.
Just to add that I don't think, so travel restrictions are not only useful in a situation where there isn't a single case, but it is true that they only make any sense in a situation where you can do test and trace. So I come back to my earlier point that you really need to distinguish, I think, between a baseline situation where there's a very low prevalence, where you want to track the cases that do exist, whether they come from abroad or domestically, and then suppress the disease that way, or you're in a situation where the prevalence is already high. Now, when the UK introduced quarantine rules for travelers from abroad, prevalence of COVID-19 in the UK was higher than virtually every country those travelers were coming from. That just doesn't make any sense. I do think there is a role for travel restrictions, and I even think there is to some extent a trade-off between social distancing and travel restrictions, but travel restrictions only make sense in a situation where we rely on track and trace rather than on lockdowns.
Yes, and perhaps, as you say, they have to take place rather early in the process. So,
or late after we have reduced prevalence by a lockdown.
Perhaps, or before we, but doing it before we know that we need to do it is also making it very hard, isn't it? You know, because we, as I said, the lead time can be much longer than we realized, and we didn't really understand that. So we've got a question from Charlie Stott. Charlie, you.
Hi. I just wanted to comment on the idea of taking a multidisciplinary approach. Obviously, each discipline brings with it a set of values in terms of what they think is important. So an economist is going to be thinking about the monetary value, the public health person is going to be thinking about minimizing deaths. How do you kind of, if you take a variety of people from different disciplines, how do you bring them together and build a plan that takes into account all of those different perspectives without sort of just leading into chaos?
I'm hoping that we would all, as British citizens, say, thinking about Great Britain, have the same objective in mind, and that is to, you might say, minimize total harm, or something close to getting agreement on a criterion like that. And we do need the public health people, and we do need the economists and the behavioral scientists, because we're going to propose policies where people will react. There will be costs, there will be benefits. And I do think SAGE was very poorly constructed from the start, I'm afraid. In a way I would describe as extraordinary. Everyone knew very early on we were weighing up economic losses and also mental well-being losses with health, immediate death losses. And we just allowed a monopoly of really epidemiologists to decide, and they ran back to what they understand, which is to minimize deaths and not think about the cost, just like an economist would have run back to what they understand, let's minimize costs or whatever. So I don't think it's hopeless to believe that a bunch of sensible, intelligent men and women around a table could agree on the objectives, and then they all contribute knowledge and reach consensus.
Do you think
their individual values, but on if that's what we're trying to do as a society?
You think the choice of who was in SAGE was motivated by a kind of bias towards harder sciences, or something like that?
I don't really think in those terms anymore. I mean, I've published in many different kinds of disciplines, journals, and if you've ever tried to do an economics PhD, it's pretty hard science. And I think the committee was constructed to think about responses to infectious diseases, which is fine, but of course this was a global pandemic, and it wasn't like dealing with a very narrowly defined, limited infectious disease.
Yeah. So, Thijs, do you want to come in?
Can I just add that this is not a new problem. So contrary to your belief, which was reflected a bit in your comments, economists are aware that money is not the only thing that matters. It's just that we tend to use money as a unit to translate everything into, so that we can compare apples and oranges. Public health researchers have a very similar approach, except they don't translate things to pounds. They translate things to quality adjusted life years. But it's the same idea. And I don't think it's this new. Public health people have been thinking about trade-offs between expanding somebody's lifespan while reducing the quality of their life. Is that a good thing or a bad thing? Doctors are used to think in those terms, and I don't really understand why that thinking isn't applied so much to the COVID-19 pandemic. It is, for example, to cancer treatment. Some people are deliberately not treated because it is felt that the costs outweigh the benefits.
I'm wondering what you both think about sort of long-term effects on the economy in terms of the labour market. I mean, because a lot of the employment in the UK that we've had are in those parts of the economy that have been very badly hit. So hospitality, tourism, leisure, etc. And a lot of the low skill entry jobs are also in those sectors of the economy. So there's quite a hit to take if those jobs don't come back at a certain quantum.
It's certainly going to be very hard on young people, lower skilled individuals, those early on in their working life. Thijs might have views on this, as he's worked a lot on the labour market.
I think there is no doubt at all in my mind that there's going to be extremely severe long-term consequences, but I think there will be those severe consequences on the economy and the labor market in particular, regardless of how we respond to this pandemic. There's this interesting research that was publicized heavily early on. It's evidence from the Spanish flu pandemic that if you don't respond at all to a pandemic, your economy still goes into a deep recession just because of the direct effect of the virus itself. So I don't really think there was a way out of that. But obviously it's going to matter what we do, and we should be thinking about that.
Well, yes, because
I think the really difficult thing that I imagine Sunak thinks about, or I know he thinks about, is you need to make a judgment call whether changes in labor demand that are driven by the pandemic and the lockdown are temporary or not. Because if they are temporary, you want to compensate people, you want to furlough them, and you want to try and keep those jobs. If, however, they are permanent, you cannot possibly afford to do that forever. So, and that's a really, really hard, this is what I have studied in the past, labor market mismatch. Something changes in the economy, in this case, a pandemic hits, but it could have been a technological innovation, which means that demand for some skills goes up, demand for other skills goes down.
Yeah.
It happens all the time, and the labor force responds to that. But the problem is that while the labor force is adjusting, there is high costs associated with the mismatch, unemployment, lower wages, poverty. So I don't envy Sunak for having to make that call, because I genuinely think it's very difficult. And I personally was very much mistaken when the pandemic hit. I was of the opinion that we should pretty much bail out everybody and everything, because I thought of this as an intrinsically absolutely transitory shock, a temporary thing. I now realize that it's a lot less temporary than I had anticipated, and I'm much less sure now of what is the right response in terms of furlough and income support.
yes, because as Andrew said, the long-term consequences of that and the burden of debt are enormous. But also the other thing is that this isn't going to be the only pandemic. So the other work that we've been doing, so on, for example, the impact of urbanization, deforestation, and the push of agricultural lands into areas. I mean, all of the scientists who are talking about that now say you have no idea how many of these viruses are actually sitting in those reservoir areas, and all of them could affect humans. So the idea that we could just deal with this one and then move on is not really a possibility. So it's a series of potential.
That does appear to be correct, yeah, I'm afraid.
Yeah. So that in terms of understanding how an economy runs, so I think we're almost out of time, but if I could ask you both just to say something at the end about what are the challenges of being an economist in these conditions of extreme uncertainty? So how are your models holding up? How are you doing? I mean, what is economics here in this kind of situation?
It's probably a bit early to say how well the models are holding up, because of course the economic repercussions, first of all, will take a long time. And second, Mr. Sunak, in a way, is doing his best to slow down the repercussions by bringing forward all this money and just drawing up debt. When I say bringing it forward, spending the next generation's money before they've earned it and before even some of them are born. So it is too early to say. I don't think that economics is fundamentally challenged by the pandemic. It has its strengths and its weaknesses, and that will continue. I just think we need to blend with other disciplines. My colleague Thijs might have a different view, though.
Thijs?
No, I agree. I think the economics profession has a horrible image problem. I think we as a profession are to blame for that, because to a non-economist, what an economist says sounds very similar whether they know what they're talking about or not. Whereas to an economist, it is quite clear where we actually know something and in other areas where we're just speculating. And I think as a profession, the challenge we face is because we're extremely harsh on each other. So you can trust an economist to disagree with every other economist, We don't need non-economists for that. But as a profession, we face the challenge to filter a little bit what we bring out as strong recommendations. And there is this general impression that we really messed up in the response of the Great Recession. Whereas I'm not sure that's true. It's clear that we really messed up in forecasting the probability that such a thing might happen. But we did reasonably well in agreeing on recommending a policy response to the Great Recession. So I think the challenge we have now is that when we say something that people really shouldn't be listening to, half the time people listen. And when we say something that really people should be listening to, nobody listens.
Yes, well, that of course is the profits in their own country and all of that, but it's a difficult thing. But also there's just a question that we might be entering a slightly different phase in human history, and that could be connected, and this is something that we do quite a lot of work on in the IGP, to the way in which we have been treating the finite resources of the planet, right? So that we might be at a tipping point where some of these things are actually very difficult to model because we've never been at that point before. And understanding what's going to happen to our societies and our economies is going to be actually quite a challenge at that moment. I don't know what you feel about that. If you think that there could be a historical moment here that we're facing, in other words.
I certainly think I should have been working on climate change economics 35 years ago. I've been working on it recently, and I encourage all young researchers to do the same. My instinct is it's not right to think about break points or tipping points. I view it more as a smooth curve, but it's a curve that is causing us huge trouble, and really it's more important than COVID.
Yeah. Did you want to come back, Thijs, or you happy to come? You come in?
Well, I agree with that, and I want to point out that Andrew is one of the very few economists who are trying to actively move the profession into thinking more about global warming and related issues.
Well, look, we've come to the end of what's been a wonderful afternoon. I just want to thank you, both of you, Andrew and Thijs, for very, very good discussion, which we've hugely enjoyed, and for giving your time. I'm sure Andrew and Thijs, you've done both must have done lots of these kinds of occasions on these issues. And I couldn't agree more that the most important thing is that we should be having these discussions. And there are difficult issues here, and how they're to be resolved, we don't know, but we need to engage with that. That's the job of all intelligent people. So, that we should be having those discussions. And so thank you very much indeed. And I've asked the panel to unmute, because the panel actually unmuting can actually give you a round of applause, which the attendees can't.
Thank you.
So thank you very, very much indeed. And hope to see you soon in better times. Thank you. Bye-bye.
Thank you.
Bye, everyone.
Thank you very much. Bye-bye.
Bye.